Hi, I'm Tom Spetalnick. I'm an optometrist who's been practicing since 1986. I know I look a lot younger than that. My specialty is refractive surgery, taking care of people's vision, trying to give people an opportunity to surgically improve their vision. I don't actually do the surgery. It's my job to tell patients if they can have it done and how they should have it done, and triaging them to the surgeon in our practice that makes the most sense. My interest in optometry started when I was a kid and I had bad headaches, and everybody thinks that it's a good idea to start with the eye doctor. But really I didn't have any severe vision problem, but it was just enough of a dose of eye care for me to be fascinated by it. And from that point on, I was always thinking, maybe that's what I want to do, because the eye doctor I went to had a very nice demeanor about him, and he had all the coolest toys to look at eyes with. So what I do, first of all, is in my day-to-day work is different from what other practices do. But first of all, it's also different from what other optometrists do. I'm very specialized within the eye care field, and so I'm kind of a nerd about all the different ways we can fix vision and trying to get familiar with the technologies that can be used. I really am focused on being able to communicate that to patients. As far as being professionally rewarding, training young optometrists in this field and seeing them get placed in practices that they're excited about, that's hugely professionally rewarding. My family means everything to me. My wife is my optometrist and does a great job. My kids are the light of my life, of course, and I get excited whenever I get to see them, and when we get to do things together like mountain biking, it's the greatest days of my life. Outside of work, I used to play a lot of basketball, but then I got kind of old, and so it's kind of tough to run fast and jump high when you're 57 years old. So now mountain biking is a little easier on the joints unless you fall down, which happens from time to time. Play a little bit of tennis, sometimes with the wife, sometimes with my tennis buddies, and those are the things I really enjoy outside of work. You know, I don't worry about patients being nervous about coming in, other than to say it's really normal to be nervous. I do think that when we give them open and honest answers, we wash away most of the concerns, but we don't want to do it in an artificial way. So sometimes patients come in and they have a list of questions, and we try to channel them as to which of those questions are the right questions. So we want to answer all of their questions, but we really want to give people perspective on which of those concerns are justified and which of them shouldn't be as justified. People worry that the procedure is going to be horribly painful. Well, it isn't. People worry that there's some huge risk of loss of vision. Well, there isn't. But then again, if people are worried about, will my eyes be dry, will I have some glare at night, sometimes the answer is yes, we expect that to be a temporary symptom. We don't expect that to be a permanent life sentence. And we just have to cover those things and give them, again, perspective on which of those things are legitimate concerns that they should have and that we should have, and which of them are not really things that need to be so anxiety-provoking.